is Alexia. Today I'll be performing a head-to-toe assessment on my patient. I'll head to my patient's room and knock on the door. Knock, knock, may I come in? I'll close the privacy curtain or door to provide patient privacy. I'll then perform hand hygiene and apply clean pair of gloves. Okay, then I'll introduce myself to the patient. Hi, I'm Alexia. I'm going to be your nurse for tonight. May I see your wristband, please? Can you tell me your first and last name, date of birth?
Oscar Cortez, March 25th, 2005.
Okay, thank you. So now I'm here because I'm going to do a head-to-toe assessment on you. I'm going to inspect you from the head all the way down to your toes. Is that okay?
Yeah.
Okay, so looking at my patient shows no signs of distress. He is well groomed and he is sitting comfortably. Now I am going to assess my patient's vital signs. My patient's blood pressure is 110/83, heart rate is 78, temperature is 97.8, respiration rate is 18, and oxygen is 99% on room air. Are you feeling any pain?
No.
Okay, great. So now I am going to start by taking a look at your hair. Look at your hair. Okay, hair is evenly distributed. There's no signs of infestation. Now I am going to look at your take a look at your hydration level. I'm going to pinch the side of your neck, okay? It's not going to hurt. Okay, so my patient's skin sugar is non-tinning, sorry. And now I'm going to assess your skin. I'm going to have you lean forward a little bit so I can take a look at your skin on the back. Okay, I'm going to take a look at your arms now. Take this one. Okay, I'm going to take a look at your legs, heels and toes. Same to the other side. Okay, so my patient's skin is dry and warm. There's no signs of abrasion, wounds, or rashes. And also my patient's bony prominences shows no sign of skin breakdown. I'm going to check my patient's nails. Let's see. Okay. My patient's nails shows no signs of cracking or denting. Now I'm going to check your eyes. Can I have you look at me, please? Okay, eyes are symmetrical. Now I'm going to pull your eyelids down so I can check your sclera. Okay, sclera is white. Now I'm going to have you, I'm going to point at you with this flashlight, and then you're going to look at me, okay? Look at me. Okay. I'm going to have you look at the pen light and look to the wall without moving your head, okay? Pen light, wall, pen light, wall. Okay, great. So my patient's pupils are equal, round, reacted to light, and accommodation. Now I'm going to look at your nose. My patient's nose is symmetrical. Now I'm going to palpate the sinuses. Okay, my patient's sinuses show no signs of swelling or inflammation. Now I am going to take a look inside your nose. Can you hyperextend your head for me and take a look inside your nose? Okay, so my patient's nose is moist and intact, and the septum is midline. Now I'm going to have you cover one nostril and you're going to breathe in and out for me. And we're going to do the same thing to the other. Okay, great. So my patient's nares are patent, which is good. Now I'm going to take a look at your lips. My patient's lips are moist and intact. I'm going to have you open your mouth and I'm going to flash the light, okay? My patient's oral mucosa is moist and intact. Teeth and gums are intact, and uvula and tonsils are intact as well. Okay, good. Now I'm going to take a look at your ears. I'm going to check for the tympanic membrane. Okay, great. My patient's ears are intact and no drainage is visible or shown. Now I am going to look at your neck. I'm going to palpate the lymph nodes, okay? Okay, so my patient's lymph nodes show no signs of swelling or inflammation. Now I'm going to look for your, I'm going to check your trachea. Okay, trachea is midline as well. Now I'm going to check for your jugular vein distension. Okay, there is none. Now I am going to ask you to rotate your neck. I'm going to have you look up, down, left, and right. It is to assess my patient's range of motion on neck. So my patient is full range of motion, has full range of motion on neck. Okay, great. So now, are you experiencing any coughing, shortness of breath?
No.
Okay. I'm gonna ask you to take your lungs. Listen to your lungs, okay?
Okay.
All right. I'm gonna take a big breath in and out, okay? Relax. Okay, great. So my patient's lungs are clear in all lobes, and there's no adventation sounds noted. There is no accessory muscles noted as well, and looking at patient, there's no signs of liver breathing. My patient's chest falls and rises symmetrically, bilaterally, and equally. Now I am going to listen to your heart sounds, okay? Okay. I'm just gonna relax, okay? Okay. My patient's heart sounds are, my patient's heart sound and rhythm are regular. I'm gonna check your radial pulse, okay? I'm gonna have you turn your arms like this. I'm gonna check. Okay, radial pulse is 2+ bilaterally. And I'm gonna take your check your femoral pulse. Femoral pulse is 2+ bilaterally as well. I'm gonna have you put your legs together. I'm gonna check for the tibial pulse with the dorsalis pedis pulse. Okay, so dorsalis pedis pulse is 2+ bilaterally as well. Now I'm gonna check for your capillary refill. Okay, I'm gonna have you these fingers. Let me see. I'm gonna squeeze. Okay, capillary refill is less than 3 seconds on upper extremities. I'm gonna check the tongue, the lower extremity now. Okay, so capillary refill is less than 3 seconds on lower extremities as well. Now I'm going to assess your abdomen. Have you having any problems with your bladder or bowel movements?
No.
When was the last time you had a bowel movement?
This morning.
Okay, so I'm gonna listen to your bowel sounds, okay?
Okay.
All right, I'm gonna remove this pillow as well. Okay. Now I'm going to assess for your bowel sounds. Okay. So bowel sounds are active in all 4 quadrants. Now I am going to palpate your abdomen, okay? Let me know if you feel any pain. Okay, so abdomen is soft and non-tender. Now I'm going to have you sit at the side of the bed for me, please. Okay, are you experiencing any joint pains?
No.
Okay, great. So we're gonna access your range of motion on upper extremities. I wanna have you lift your hands up, raise your hands up. Now you're gonna go in circles. Okay, now you're gonna put your hands like this. And don't let me push in, against you, okay? Okay, great. So my patient has full range of motion and strength in upper extremities, bilaterally in upper extremities, sorry. Now we're gonna do your legs. I'm gonna have you raise this leg up. And now you're gonna lace this one up too. And then don't let me push against them, okay? Okay, great. So my patient you can put them out. My patient has full range of motion bilaterally on lower and strength. Sorry, my patient has full range of motion and strength in bilaterally and lower extremities. Now I'm gonna have you lift your legs up for me, and now we're gonna move your ankles up and down. Okay, now we're gonna do circles. Okay, great. Now I'm gonna push against them. Don't let me, okay? Okay, great. So my patient has full range of motion and strength bilaterally in ankles. Now I'm gonna have you stand up for me. And you're gonna bend down and touch your toes. Lean forward. Okay, you can come back up. Okay, now I'm gonna push against your chest. Don't let me, okay? Okay, great. So my patient has full range of motion and strength on his back. Now I'm gonna have you walk around a little bit, just a little circle. Okay, now you can take a seat. Okay, so my patient's gait is good. He has good center of gravity and coordination is steady and well balanced. Now I am going to ask you some questions, the same questions I asked you before, okay? Can you tell me your name?
Oscar Cortez.
Can you tell me where we're at?
At the hospital.
Okay, and can you tell me what month we're in?
July.
Okay, thank you. So now that I've talked to my patient is alert and oriented times 3. And if I were to rate my patient in a glaucoma scale, he would be a 15. His response is verbal and motor response is full intact. Okay, we are done with our head to toe assessment. You can either take a seat or you can lay back down. Okay, are you comfortable?
Yeah.
Okay, so now my patient is comfortable. I'm gonna put side table and call light within reach. I'm gonna remove my gloves, throw them away, perform hand hygiene, and we make sure we do patient education before we leave the patient's room. Thank you.